Truth, the official radio station of the Church of Christ or Iglesia ni Cristo.
You're listening to INCRadio.
Broadcasting live from Chicago, Illinois. DZEM 954 AM station. Here to bring you great conversations about faith, people, places, culture, and recent events all around the district. Join us on YouTube at INCRadio.org. Hello, Northern Midwest and the rest of the world. It's time to get this show started.
Yes, it is time to get the show started. Hello, welcome everyone. Thank you for tuning in to another episode of INC Radio Northern Midwest. I am one of your hosts for today, Brother Elson John Cruz, live here from the local congregation of Rockford, Illinois, here in the district of Great Lakes. And yes, just want to have a quick time check. It is currently 3:05 in the morning, or in the afternoon, I should say, here in the Central Standard Time. I know in Eastern Standard it is 4:05 in the afternoon. In the afternoon, I should say. And of course, we do want to just promote and just to tell everyone to subscribe to Answer Radio Northern, not Answer Radio. DCM 954, not Answer Radio Northern. And of course, don't forget to download the streaming apps that we have for both Android and iOS devices. And if you're tuning in with us, you're listening, just feel free to share your comments, your greetings, any upcoming activities that you would like us to mention during our show. And yeah, we'll say hello to our team live chat a little bit later on. But before that, let's first see the different activities we had here in both districts of Northern Plains and Great Lakes for this past week with our CFO in action.
Brethren from the Ecclesiastical District of Great Lakes are showing their unity and coming out in various acts of Christian giving. Our brothers and sisters in Indianapolis brought love and warmth into the heart of the biting Midwest cold by holding a winter clothing drive to benefit a local emergency women's shelter. Thank you for showing up for these women in their time of need, brethren. Meanwhile, Lake County and Racine brethren spent a day serving hearty soups and providing musical inspiration to members of a senior living community. Within the Church of Christ, we never stop cherishing and valuing our elders. Our light most surely shines with this gift of service and community. Cincinnati and Milwaukee, on the other hand, set their sights on a selfless and courageous group of people who help keep communities safe, the firefighters. Two firefighter appreciation activities allow the brethren to connect with their local fire stations, give tokens of gratitude, and share their faith. Moving on from INC Giving, works of propagation are still continuing. From Welcome My Brethren in Bloomingdale to Chicago, opening their doors to the neighborhood on Family Fun Fridays, and to Cincinnati's Friday Youth Mission with music and gaming, we never stop reaching out to the world and giving them the opportunity to find the true faith. Coming up next, it looks like some of the congregations are getting in touch with nature. Lake County brethren are taking a trip to the zoo, while Cincinnati brethren are getting ready for an aquarium tour. Don't forget to send us pictures. For CFO in Action for Great Lakes and Northern Plains, this is Sister Iris Price.
Yes, thank you, Ata Iris, for sharing those wonderful, wonderful activities from the Great Lakes and Northern Plains districts. We see them both here in our YouTube live chat at the current moment. So shout out to all of you who have tuned in. Just a reminder again, please let us know where you're from and hashtag your local congregation. And speaking of our topics and activities, we are going to today continue our discussion on first aid. Um, we talked about last week, um, you know, the medical visits and what to do when you're sick. But today we're gonna take it. I don't want to say step up because that sounds a little harsh, but there may be situations wherein you may need to decide whether your medical condition needs a visit, warrants a visit to urgent care or to the ER. And with us this afternoon, we have here from the District of Northern Plains, Sister Jen. Good afternoon. Thanks for joining us this afternoon.
Good afternoon. Thank you for inviting me. It's a great pleasure to be here, and um, it's my pleasure to be here today.
Thank you, Sister Jen. I had a cough. Sorry, I didn't want to go over it.
Maybe
I was
maybe
wondering if
time
I
for
should jump
urgent
in.
care.
I hope it's not as serious as a. It's just a cough. I promise. I'm not sick or anything at the moment, EJ. So I'm sure. I know you're a little close to me, but you're fine.
I will wear a mask. And for everyone there in the live chat, we do want to just prompt this question to everyone. If you can all share your family's ER or maybe urgent care like stories there in our live chat. But yes, just to get our this discussion started, we do have a couple of questions for you here, Sister Jen. So the first one is actually just if you can just give us an overview Paul, of what an emergency room is, what services they offer, and like the medical problems that are typically brought to the ER.
So, medical problem brought to ER, such as severe injury. If you're in a motor vehicle accident, collision, obviously go to the emergency room to be evaluated. Uncontrollable bleeding, uncontrollable pain, such as abdominal pain, back pain, difficulty breathing or shortness of breath, loss of consciousness, chest pain, heart attack, stroke. And for children, usually we want them to be get checked if they have fever with rash, poisoning, fracture, and persistent nausea, vomiting, and diarrhea.
Sounds like very serious stuff. But what about urgent care, Sister Jen? Is it the same thing, or what kinds of services are brought about, or what kind of yeah medical concerns are treated at urgent care facilities?
So urgent care, such as flu or cold, like what you have, or persistent cold, fever, sprain, like ankle sprain, someone fell and it's just a sprain, no serious fracture. Those could be done in urgent care. Difficulty or painful urination, that could be a urinary tract infection, that could be a urgent care. Mild to moderate shortness of breath, or children with asthma, severe cough, sore throat, minor rash, or mild cuts with bleeding, or nausea, vomiting, diarrhea, as long as it's not persistent, those could be seen in urgent care.
So actually, what I'm getting is like urgent care is like it's you can't wait for the appointment anymore, but emergency is urgent care, like really more serious problem. But how about the hours, Paul? The hours of operations of uh, those people. What's the typical hours of operation for hospital ER versus a typical hours of operation for urgent care facility?
So urgent care, typically they're like office hours. They're open 8 a.m. or to 8 p.m. on weekdays, depending on the locations. On weekends, some of them are open at 9 or 10 a.m. on Saturday. And then on Sundays, again, it varies. It could be from 10 to 2 or 10 to 10 a.m. to 5 p.m. And then for ER, emergency services, they are open 24 hours.
Really nice. That's really nice to think about. But I know although those facilities may be open at different times or like 24 hours, like you said, one thing that sometimes does bother me at times, especially if it is urgent, as I say, is the wait time. Are there any differences between emergency care and or emergency rooms and urgent care waiting times, Sister Jen?
Waiting times, Again, varies on day and the time, and then the urgency of your condition. So there's always waiting time in ER, and they call it triaging, where they have to triage each patient as they walk into the ER. um, I always tell my patients to avoid trauma center if possible. Trauma meaning that's where all the accidents are being brought by EMS. So if you have an option in your area that is not a trauma center, there's a less likely that you will have a shorter waiting period. And the triaging that I'm talking about is a patient walking into the door and having a chest pain versus a patient walking with a minor or severe cough. Obviously they will treat that patient with chest pain first. So it varies on every condition and medical problem as they walk into the ER door.
So let's say someone has concern about their health. Like, how would you guide them about whether in choosing if they should visit the ER or urgent care? And also, if you can also answer, for like, when should they call for emergency services?
Good questions. These are good questions. So for urgent care, urgent care have shorter wait time, and then it costs less than ER, obviously. However, they don't accept emergency situation. So keep in mind that urgent care are not a substitute for emergency care, as they don't have the same equipment or trained staff that emergency department have. So ER is for life-threatening medical emergencies that was mentioned prior to our discussion. And then your question about when to call 911, there's just like the CPR that they call follow the ABCs. So same thing before you call 911, we recommend to follow this ABCD. A is for airway problem, like a person could not breathe, you have to call 911. Breathing difficulty or shortness of breath, and then C is for chest pain. So someone having chest pain that is not going away, that's the time that you have to call 911. And also under letter C is changes. Any changes of your vision or your speech, it could be a slurred speech, that could be stroke. You have to call 911. And then D is dizziness, severe dizziness that would lead to loss of consciousness, and then the other, which is not belong to the ABCD, but anything severe bleeding, severe injury, those are the time that you have to call 911.
Ah, very nice. I was thinking to add letter E for emergency. It was
Yes,
ABCDE. Everything else.
any emergency.
That's when you should go to urgent care. I just want to quickly read to break in our discussion a little bit some stories from our YouTube live chat. Just a couple. From Sister MJ Solomon, she said that her daughter Maddie, when she was 2 months old, she had chest pain and when Sister MJ, not Maddie, when Sister MJ was had chest pain when her daughter was 2 months old. She had gallstones and ended up having gallbladder surgery. And then Sister Iris, shout out to Sister Iris. We miss you. Her son hit his head in school and needed staples, and so she brought him to the ER. And when it was time to take out the staples, they brought him to urgent care. So we could see a great difference in those situations, right? The urgency, like what you're mentioning, Sister Jen, right? The pain. Um, Dizziness, all of those more severe symptoms are what indicated urgent care, right? So, all right, emergency care. I might confuse the two. So, emergency care.
Emergency care.
Yeah.
And we do hope that that our all of our viewers, listeners, there are learning something as we go through this topic. And actually, in this second part of like our discussion, just going now into a little bit of like as a career, but is there kind of like a difference between skill levels and credentials for medical professionals working in the ER versus medical professionals working in urgent care facilities?
There is. So emergency nurse, they have more qualifications. So they have to be at least associate. They have to have at least associate degree or bachelor's degree. They cannot be a licensed practical nurse. So that's the main requirement. And they have to have at least 2 to 3 years of bedside nursing experience, meaning you cannot be a ER nurse if you just graduated from nursing school. you need to go out there and have at least 2 or 3 years of bedside experience. Some facilities they require their ER nurses to be certified emergency nurses, but not all of them. So ER nurses they are trained and prepared to deal with extremely stressful situations, and they are expert in critical thinking skills to deal with this urgent, emergent, or emergency situations as they walk into their door.
That is very interesting. Um, I would I guess that does make more sense too because emergency rooms you kind of have that elevated service there to take care of the more severe cases. So I guess a follow-up question to that Sister Jen, what types of testing can you receive at urgent care versus the emergency room? Like I know maybe for some example I need some like blood work done. Where would I go for that? Or if my child needs to get a physical done, is that just something urgent care? Or I'm pretty sure I don't need to go to the emergency room for that. But what type of services do each provide?
So I'm going to go over the testing available, but for like lab work, you can do that with your primary care physician or annual physical. Those are the well exam that could be done by your primary doctors. But if you have any cough, fever, those are can be tested urgent care. So urgent care is limited to rapid tests. So COVID, which you can do that now at home, you can have a COVID test. If not, you can go to urgent care. You can have a flu rapid test. You can have urine check to see if you have a urinary tract infection. And some locations, they also have x-ray capability in urgent care. In emergency room, they could run lab work for emergency situation. They can do ultrasound. They have the equipments that they all needed to do a CT scan and MRI based on the medical problems the patient has.
Mhm. And lastly, po, just before we do end this topic discussion, po, is there any final tips that you want to give our audience, po, in terms of like making visits towards ER or urgent care facilities, po, or making their visits as low stress as possible, I should say.
So if you have to go to urgent care, you can check in online, and then see their locations. For ER, check their website for wait time. So if you have different options, if you have 2 or 3 options where to go to ER, you can go online and see their wait time, and then make that wise decision. So if you go to any of this facility, make sure you bring your insurance card, your identification card, your driver's license, your medication list, and most of all, bring companion, and most importantly, to pray before heading to urgent care or ER.
That is such great advice, Sister Jen. Thank you for sharing all of that with us. Both in these past couple of weeks, we've had really great information. So I guess that's a sign. Don't be scared of the hospital. Don't be scared of the doctors, the nurses. I know needles might be scary if you're scared of like shots or vaccines, but no worries. They are there to watch out for your health. And so we would like to, in a way, give a shout out to all of those doctors, nurses, paramedics, even those who are in healthcare in a sense. So, by signing for CSD this week, healthcare worker. So let's learn how to sign that in This Is Your Sign.
This is your sign.
When we need medical attention, whether if it's with a doctor or a nurse, or maybe even a therapist or a psychologist, those are known as healthcare workers. They're the ones that we look up to whenever we need mental or physical help. So we thought it'd be fitting for today that we'd sign the word healthcare worker. So we'll be splitting this into two different words. So healthcare and worker. Each of these together will have 4 signs in total. So let's start out with healthcare. So the first part, what we're gonna do is that we're gonna be taking both of our hands and pretend that we're grabbing onto our shoulders with our fingertips touching our shoulders just like this, like you're about to grab them. And then what you'll be doing is that you'll be extending your hands and shaping them into a fist. So that's the first part. And then the next part, what we're gonna do is that we're gonna be making the number two, the letter V or a peace sign, whatever we wanna call this. And then what you'll be doing is with your non-dominant hand, you're gonna be extending it and pointing it out like this with your dominant hand on top of it, just like this. And then what you'll be doing is that where you're at right now with both of the hands, just make a small little circle. It doesn't have to be gigantic, just a small circle, just like that. So this is healthcare. And now for the word worker, what we'll be doing is that, again, we'll be shaping both of our hands into fists, just like this, okay? And then what you'll be doing, again, with your non-dominant hand sticking out just like this, your dominant hand will be touching its wrist to the back of the non-dominant hand just like this. That's the first part. Next part, what you're gonna do is that you're gonna take both of your hands and have it parallel just like this, separated from each other, and just go down like this. You're about to straighten something out. So that's the second part. So again, this is worker. So all together, and we'll go slowly. So this would be health, and then care, and then worker. That's how you sign healthcare worker. Thank you so much for joining us in our sign of the week, and we hope that you'll join us in the next upcoming activities. Thank you.
This is your song.
Thank you to our Christian Society for the Deaf for sharing with us and for always every week teaching us different sign languages. And the next part of our show, of course, is I know you're all looking forward to this, our hashtag challenge winner. So let's see who won last week's hashtag challenge.
I don't know if you have any guesses yet.
I know it's always changing. Oh, want to say first to Brother Henry Timson from Aklan for joining us last week. Whereas the local congregation of Rockford, Sterling Heights, Lake County, and Louisville for winning second place, and for first place is the it's still the local congregation of Bloomington.
Nice. Congrats. And individual.
Congratulations to everyone, and keep sharing your hashtags there in live chat.
And then a shout out to Sister Rachel Weiser and my mom, I think, who was individual winners too. So awesome. I can't wait to see who next week's winners are. Looks like there may be a change. We'll find out next week. But for today at least, we would like to thank you all for tuning in to INCRadio Northern Midwest. Thank you again to Sister Jen who has joined us. Do you have any quick greetings or shout outs before we wrap up?
I would like to shout out to all the brethren of local of Kansas City and all local of Northern Plains.
Woohoo! We saw that they're very active in our YouTube live chat, Sister Jen. Lots of Kansas City brethren who are in there. So thank you all again for joining us. Thank you, Sister Jen, for joining us, and thank you to all of you who have watched this afternoon. We would like to give a shout out to both our districts. For Northern Plains, we would like to thank Brother Alpha Tumbaga, the multimedia advisor, and Brother Elmer Parunga, their district minister. For the District of Great Lakes, we would like to thank Brother CJ Manalan Sun, who is our multimedia advisor, Brother Juni Alarin, our CFO advisor, Brother Art Agag, our assistant district minister, and Brother Ermin Bendicio, who is our district minister. For INC Radio, we would like to thank Brother Arnel Solano, who is our station manager, our executive producer, Brother Manly Andaya, our techs, our Kuya techs, and at the tech, who is there on screen, who have helped us behind the scenes today. And last and certainly not least, Brother Angelo Orano Vimanalo, who is SEBSI President, CFO Coordinator, and Brother Eduardo Vimanalo, our Executive Minister. Uh, Coming up next is INC Radio Sacramento, California. So you can watch their program if you're on the 24-hour link, or you can go onto their separate link as well. But please continue to share this broadcast, share this link with all of your friends and loved ones, because this has very valuable information that I'm sure everyone will appreciate. So, and don't forget, everyone, to please continue to stay phenomenal. We thank you so much. We will see you next week, 3 p.m. Central, 4 p.m. Eastern. Bye.
Bye, everyone.